access to all the textbooks yourself. Go. Yeah, it's a kind of a different. Anything out from this with a little finer needle here. So you're numb there, so you shouldn't feel this, okay? And let me know if anything hurts you at all. But we're gonna try to see if I can't pull some of the product out. It's probably gonna be such a small amount that it's not even gonna be that noticeable. I mean, in my needle hub here. Did anything come out? I don't see anything yet. Do we have a little Olymp blade in here by chance? No, probably not. It's okay, you don't think anything yet. Just wondering because oh, I don't see anything come out from this one. But I think I made a little nick on the top of it. Let's just see if I can. I mean, I can't tell because it's such a small little bumpy on her. I'm just gonna push against it. Straight down. So you get more of a gel-like look or like a little blackhead or whitehead kind of look. Maybe this is a little whitehead instead. This would look like a cyst more so.
Sometimes it's like gel.
Yeah. Let me get it. Oh, come on. That one I made a little nick with the needle instead, and it's numb here, so I'm just gonna squeeze against it a little bit. And I do think we're gonna get out. We flatten that nicely here. A little whitehead here kind of thing. Let's see if we can't get all of it out. Let me just turn that sound off here. This is no big deal. This is just from quality. Just in case. Hey, I think we did. I'm trying to do as little trauma too as I can. Just trying to push and ease this out as best as I can so that you don't get, because she's darker complected just like me, we get brown spots after we squeeze on something. So that's the problem too, that she looks like she's got a lot more bumps here than she actually does because of the squeezing all these areas, or they've been expressed before. So it takes a little while for that to heal. It looks brown for a while, but that does go away. That is not technically permanent scarring to anybody. I get that a lot with patients, by the way. People will come in and think that, oh, can you take care of these scars? Look, these are permanent, but they might just have redness or they might have brown, and that is not permanent. So you're not alone in that. All right, I'm gonna put one on this lower one. You okay?
Oh yeah.
Okay. I think that you'll, at least you're going away with something here. I feel like. And you did try a hydroquinone before?
I did. I don't remember what strength it was now.
Okay, I'll try to get you that too then. The only thing dripping is just the numbing medicine that we use there. And I'm gonna make a tiny little nick right over that little opening, just a baby one for her in particular, because I don't want it to be too traumatized. And then let's squeeze this one here. One little pressure on the outside of this one. There's two little whiteheads next to it. I'm gonna have to say that I think these are more like you had them removed before and diagnosed, right? They biopsied it back at your home that
yes.
That they said that was steatocystomas. And you also say that you had oily kind of texture come out of them.
Yes.
You have a little baby small one here I can get some of these baby blackheads if you want me to.
Sure.
Okay, little baby pincher. You have little ones, and you can certainly put something behind you so I can just grab it. Oh, they're hidden under here, girl. You're right. They're surprisingly right. Well, I mean, they come out. They're happy to leave. They wanna leave, but I think, like, I think this is a steatocystoma right here. Maybe. Let's put a little numbing right there to see first. Okay, a little baby pinch right here. There's a little bump pinch. It's like you can't see it so much, and that's why. Let me just see if this is one, but I don't think you should do all of these because I think you're just gonna get a little brown spot, you know? But I'm making it as minimal as I can here. Just one little nick there, and let's see if it comes out as a little more of an oily kind of substance. Not much there, actually. You okay?
I don't feel okay.
Oh, good. Good. No, it's a cyst. Oh, you do. You have some cysts back here. Well, I'm at a point right here that you want me to do more of them? Because you have some good ones here that I could take out.
Okay.
But if I do that, there'll be little brown spots. I don't think they're going to be as big as some of these other ones because we're trying to do it with minimal trauma. But are you okay with that? Are you okay? You can lean against there. Because I think that's what you came all the way over here from. Right? You came from pretty far, so I don't mind doing that. And thank you for letting us videotape it so people can learn your story here, you know. And isn't it nicer when you put a little numbing in it before you do it? My gosh. Let's see here. Can you grab me a new piece of gauze? You're okay like this too, huh? Yeah. I'm gonna try to get ones that you can't reach necessarily so much because they might drive you bonkers. Let's see, right here there's one. Right here, one little baby pinch overlying it, pinch. How do you like it? Did you go up there?
No.
Oh, you didn't?
No.
Did you move there for school or
I did.
for work? Oh, how do you like the school there? I hear it's such a fun town.
I actually went there for medical school.
Oh, are you in medical? Did you go to medical school? I'm so sorry. You didn't tell me any of this.
Okay.
So this is a steatocystoma, looks like, because this has an oily. Oh, it's like both. Huh. Maybe these are. I'm at a standstill here. I'm not sure. So what do you, did you finish medical school?
I did.
And are you a physician? Oh, girl, I would have been talking to you like a regular physician, not talking down to you like I did.
No, you're fine.
You know what I mean? My goodness, I would have used like normal terms.
It's fine.
All right, so what can we do for this then? Fraxel, yeah, it's an ablative laser, okay? It's not going to help with this. Post-inflammatory hyperpigmentation, it is superficial, it is deeper, and it can't be so, you know, improved with a light skin lightening cream. But I would certainly try that because it's pretty much the simplest thing to do. It's very easy and basic to do. Here, maybe one here, pinch. So are you practicing in you'll just say where. Oh, okay, lovely. I actually have some colleagues, I think they're in, or they're very close by, that are dermatologists, I think, from my program. You probably went to them? Maybe, huh? Perhaps. Girl, you do have some good ones. Let me show you that one that came out like a little ribbon. Yeah, you've seen that before, huh? It made it nice and flat. Those ones that we do that to, do they come back again or?
No.
Okay, that's all right. Then let's do it. What do you think about this? What I'm doing and putting these on YouTube? You think that's a strange thing, or you think that's the way a lot of this is going to go now?
No, I think it's the way a lot of it's going to go.
A lot of things, right? Because I feel like you can show what you do, and then people understand it more, and then they also feel like they know you. You know, they trust you, or they know what you're about. Okay, one pinch over here, pinch. I feel foolish now. I'm all talking to you like a, come on. Tell me, how do you like being a hospitalist?
I like it.
Yeah, I think it's a nice job because it's more like 9 to 5, right? Controlled, and you go home and somebody else is watching for you.
And then I'm off for a week.
Oh, wow. That's why you're out here.
Yep.
At least I didn't live in somewhere you don't necessarily want to visit. It has terrible weather.
Right.
You okay?
I'm fine.
Okay, good. Because, girl, you got good ones. Yeah, I will tell you. Okay, I'm going to reassess this that, you know, I do think that this texture of these cysts is a little bit different and it's more a little oily kind of texture, so. Can go back to the idea of steatocystoma. Okay, I think we got, I mean, I really drained those there. And it's like, I think I got most of it. Is there anything you think that I'm missing here? There's one right here that you know of, that you, in your mind, that there's one that really bothers you, like on the other side or anything? I'm gonna go to the other side in a little bit, but no,
That
okay.
I can think of. I think there's one like the center of my back.
Yeah, okay, I'll look. Mid-center or up?
Mid-center.
Mid-center, okay. I don't know where you get into that one. Not easily. You didn't think about doing dermatology? Especially with this, yeah. Especially with this kind of thing, huh? I know, it's tough.
Like other people's skin.
You know what I don't like is other people's feet.
Yeah.
But I still have to touch them. Oh, here's the one I think you're talking about.
Right.
Does it hurt when you push on it?
No.
Okay, I'll be a pinch here. It's a little bit discolored on top, like maybe you've tried to squeeze it before.
I have.
I don't know how you got to this one. I don't even want to know what kind of position you got to get into. If you feel that dripping, it's just numbing, okay? That's dripping out of the syringe. Can you scoot a little bit more forward? Actually, thank you. Now that I know she's a physician, I know she can handle it. Oh, careful. Oh, careful with all this. All right, so now you have no excuse. You need to give yourself some triamcinolone ointment, okay?
Okay.
For your eczema. You have like atopic dermatitis.
Okay.
Which is what I have too. You know, we have it and we're not really designed for this dry weather out here in particular. So you need to use a good moisturizer, like a good cream. And also, let me see if I can even get anything out of this one. I would use like an ointment for the triamcinolone. I would use an ointment instead of a cream because the ointment is stronger and is gonna stick longer. There we go, we got it. I think you got some out of this one before. You just didn't get it all. Pretty good. Why don't you regroup and put a couple band-aids on here first? I just wanted to inject them. But I think those are scars up top. I really do. The ones around your clavicle. On this one. I can see that. Oh, it's been squeezed before. I'm not gonna, that one I can't get. It might be just a little scar there. I think we're pretty good here. These are nice and flat. Let me see if this other side. These feel flat. You've gotten those. This one I'm just not sure if that's like like you can't tell by just feel whether that is indeed one of these or if it's just a scar from being squeezed. There's one right here. I'm sorry, I gave you a little scare there. Here. I mean, I don't need to. I have a printout for you, but you've got access to all the textbooks yourself. Yeah, it's kind of a different, slightly different texture and look to it. So good. Okay, lean a little forward right here. There's a bigger one back here. Good. One baby pinch here, pinch. Do you work at a pretty big hospital? Okay, it's a big town, huh? Okay. I'm like, I mean, as a dermatologist, I want to stay away from the hospital. I do not like to go to the hospital. It's usually for like rule out scabies or something. That's the problem. Unless it sounds like you're probably in a big teaching hospital, or you know, so that's different. You get to see some interesting things. So what would be ideal for you, really, to prevent these from ever occurring, I'm sure, but it's mostly the brown spots that bother you the most. Yeah, let's give you, I'm gonna give you triluma here, okay? So you can give that a try and see how that'll help you. And like I said, take a photo of it.
Okay.
Okay, because that'll help you to monitor. Baby, pinch here, down here, pinch. Again, just like, and it's also best to like try to use the same time of day, the same room, because the lighting can change things. Try to keep everything as normalized as you can. Just helpful. Help try to do it as objectively as possible. Okay, almost there. I think we just have like 2 or so here. Have you been to California before?
Yes.
Okay. Where are you from? What town? What state? Oh, okay. I'm gonna try one of these and these two with this little scar here. And if it's not, I'm gonna inject it with a steroid. I think it's a scar though. Even when I inject it, I can feel the stiffness. How long ago was this one squeezed?
I don't know.
You're not sure? That one could be a while ago.
Yeah, I could.
Now the ones you squeezed at your clavicle just recently, did it look like a cyst when you squeezed it, or nothing happened? You just kind of squeezed it and nothing really came off of it. Okay. Yeah, I think this is scarred. So I'm just going to leave that. I squeezed a little bit, but I think it was just numbing fluid that came out. And that one too, I think it's going to be the same thing. I think we got most of them. Maybe as many of them as I can feel or see. Just feeling around, because sometimes they're hidden, especially down here on your flank area. You didn't get all of these here. Yeah, pretty good. I don't know, I think we're gonna make progress here. I think this is gonna help. I do. Let me see, there's little baby. Those are small time now when I look at them. They're like a tiniest little blackhead. Okay, let's put a little band-aid on the hand. Keep my mouth shut. Sometimes they spray me. Sometimes they spray me and then that ruins your whole morning. That's why sometimes we have to inject. I try to inject on top over them. You probably see a lot of blackheads and cysts in your job too. You're not a popaholic, are you? Oh, you are? Oh, that's. Why am I saying that? Of course I know you are. You have these things you're doing on yourself. No, I shouldn't feel that. Not bad. Yeah, look at that. It's that steatocystoma, huh? All the oil trapped under there. See it? That's it. That's all you needed to do, really. Just squeeze it a little bit more around it. Get all that underneath there, girl. It's because it's like a little concave area, so you could hide it, huh? Am I hurting you?
No. Okay. I don't feel a thing.
I didn't even put that much numbing over it. I don't think that's like infected. I think it's a sterile little, it's like a sterile abscess almost. But if you were gonna take anything, if you're not allergic, I would take like Keflex or something like that. If you want, we can even write it for you. What do you think? You think that feels flatter?
Yeah, it looks flatter.
That's flatter, nice. Feel it even through this with your, if you want to feel with your finger through that. Yeah. Good? We got it all, you think? I think so. Okay, good. Okay. Sorry, that was just, it squirted out to your neck. I feel it under there. You want to see what just came out of it?
Oh yeah.
It's like better.
It is
clarified
more clear.
It's like, yeah, like clarified. Because I'm weird.
Interesting.
Let me get the other one and I'll show you when
They're
I
all the
squeeze it.
same?
Various ranges of that.
More liquidy.
Yeah, some of them are more liquidy. You okay? I feel like you could feel it more if you see me doing it. I can feel it under there and I have to keep it between my fingers to try to, it kind of pushes away from me. There we go.
I wonder if these are new.
I don't think so. I think they probably, I mean, they've been there their whole life, but they come up during puberty kind of thing. But I haven't been able to tell, I can't tell by what comes out, whether it's new or old. I feel like I can sometimes with like lipomas.
Yeah.
Right there, there we go. It's like it pushes away from you. It tries to get away from you, so I have to fit it in my finger. All right, let's see if I can't pull any of the sac out. I really made a tiny little hole in this one. That's good. I actually haven't decided, Christy, whether you have to pull the sac out. I feel like we try to, especially when it's easy. But I don't know if I feel like people say, oh, you didn't pull the sac out there. And
yeah, it's being problematic,
yeah, I feel like it's okay. I don't hear that. I think most of the time when we try to get one out, it doesn't seem to come back. Sometimes it might heal funny, a little bit funny. You know, like a firm ball, so that you feel like maybe it's a sac.
Yeah.
Or it coming back.
The firm balls are just
it could. I think it's just mainly a scar. Yeah, I think, but we'll see. If you feel like, I feel like it's a different consistency. You know, it's like a little more rubbery.
Is there a way to get rid of the scar tissue?
Well, trying to be as small as possible. I'm trying to just peek in.
Yeah.
Okay. All right. That's because these are hers are underneath her and they're under there. So I got that one up first try. So that's good. And this one too. With my fingers, I have to keep it right there and then try to pierce it. I think I got part of it. I can feel it in my fingers, but it's under there. I don't know if that one was really filled with stuff or not. I feel like I got into it. she's gonna be like, that's the one you missed. Telling you, it's...
I think there's two in that same.
Or right next to each other.
Yeah.
Couldn't even get that one.
There must be one like.
Whatever, I try to be careful, yeah. But again, you cannot even see these. There's a little, let's see if I can get it. Yeah, there we go. It's like a little piece of, like a little blood clot maybe or something. Just squeeze it out. Well, with the other ones, they healed really well. I feel like hers are, she's got a fat dermis. A thicker dermis, because they're under, hers are a little under them. Are you okay?
I'm good.
Oh, I haven't gotten that one yet. Hold on. What is it? I'm trying to isolate it. A little bit. Hers are like the tiniest tish deeper than others that we see. So it actually makes them a little harder to get to. But she seems to heal really well from them, so that's a good thing. Oh, you know what I did forget? I was looking at this and thinking, can I get a snip? That's nice for you. Okay, for this one here, I have to really squeeze them and isolate them because they're under there. You okay?
I'm good.
They're dodgy though, I'll tell you that. I think I got it. It looks like it's oily, but I feel it right here. There we go. What did it, was it from Panera or something?
Mm-hmm.
Oh,
Yeah.
I see. Nice.
And they had mac and cheese for everybody.
Yeah, actually I had that lunch today because I bought Panera for the kids the other day. The mac and cheese there is really kind of heavy. It knocks me out there. I don't want to eat too much of that.
It looked really good.
It's, I actually think it doesn't taste as good as it looks.
I hate that. We were just talking about that.
Well, it's good if you didn't eat it.
Yeah.
If you couldn't eat it.
Yeah. Like when you want something and you're like, oh man, it wasn't even that good.
Yeah,
Why did I waste my calories?
It is. She gets that because I said that her skin was thick and she was like, oh, you mean I'm fat?
No. You got thick skin.
Thick skin.
Yes, the skin itself. That's where I would go to. You know, I think I realized one time when I was like, I was complimenting a guy and I was saying, you look small, and he kind of got pissed, and I realized they don't like that. You just want to say like they look lean or they look big or they look big, and
especially
I'm like,
if it's weight, if it's like lifting weight.
yeah, and I feel like he got a little pissed at me. He was like, what? I don't look small. Okay, there we go with that. Hey Popaholics, subscribe here to never miss a pop. Want early access to all my popping videos? Click here.